Hey everybody, Dr. Mike with Complete Wellness, and we're going to spend a little bit of time talking about Graston technique, or we call it Graston Therapy in the office. So a lot of you have had this done, and if you're a patient in our office, because we get phenomenal results with these tools. So what these tools are, they are surgical grade stainless steel. Some people call them butter knives because they have a little edge on them. They might look a little rough, but they're actually very, very comfortable. And so with Graston technique, first of all, one thing to understand is you have to have Graston training to actually be able to purchase these tools. So this isn't like a cookie cutter thing that you can get done just anywhere, okay? Next of all, you want the right people doing this sort of technique. We see a lot of times people will leave gyms and things like that. They'll be very badly bruised, and the tissues have been worn down so badly that they're going to take forever to recover. And a lot of people, they look at these and that's the reason that they maybe have a negative connotation when people see these. But the proper way Graston is done is it is started off lightly so the patient gets comfortable, so the brain actually then realizes what's going on. So there's different receptors that are stimulated, and the motion receptors should be stimulated first, light touch receptors, and then it should be further progressed into the deep touch receptors and other ones. But these tools are so great at loosening up tight tendons, tight muscles, trigger points on the superficial areas of the body, and can get immediate results. First common question that we get with Graston technique: who is this good for? And the answer is pretty simple. Pretty much everybody. Anybody with soft tissue issues or tightness in certain areas of the body, Graston is wonderful at loosening those up. How it works is you put the emollient, Graston emollient, which has vitamin E and it's actually really good for your skin. They have their specific emollient because it actually works better than anything else we've tried. And it has like a creamy effect over the skin so that the tools can glide easier with more comfort for you. And this is done until we actually feel through the tools that there's less vibration or there's less adhesions in the tissues, and then we stop. So it shouldn't be taken so far as to anybody getting major bruising or the skin is extremely purple or blue. Question number 2 is, what are some crazy changes that you've seen with Graston technique? And a couple of patients that we've had have had what's called cervicogenic vertigo, which means dizziness caused from tightness and restriction in the muscles in the upper back into the neck, all the way into the suboccipital region. And so we've had a couple people that have been completely cured of that because of the tightness in there, and it was fairly unexpected, and it's just amazing. It's a game changer and absolutely life changing for those patients who, one in particular could not even drive to work for 3 or 4 weeks in a row, and this fixed it. So why did I start getting into Graston technique? Well, it fixed my plantar fasciitis. Plantar fasciitis is a horrible pain on the bottom of your feet. It's so bad in the mornings when you get out of bed and you first stand there, and your foot basically acts like this. The fascia goes between your foot with a good arch in there. When you step down for the first time, it stretches that fascia in between there, that connective tissue, and the inflammation, everything there is so painful. You almost drop to your knees. And so this helped me. It cured it in a couple visits. And I was like, I'm gonna have to do this. So I signed up, I took the course, bought the tools. Now I have 2 sets of tools for each office, and we're curing that all the time. Other common conditions that Graston helps with: frozen shoulder or adhesive capsulitis is a really, really big one. That is when the shoulder just stops moving and you can't move it anymore on your own. Actively, sometimes passively, you can get a little bit more range of motion, but this will help loosen up all of the muscles surrounding the rotator cuff and allow for immediate movement in a greater range of motion than right before the Graston treatment is done. So we've cured a lot of adhesive capsulitis using the Graston technique. All right, weightlifters and CrossFit people, these are the common problems that we see or injuries that we see that Graston is really, really good for, including myself. So a lot of us, from pulling on barbells and over rotating our wrists, the wrists get injured. From pulling a lot, you get golfer and tennis elbow, where the actual tendons going into your lateral epicondyle and medial epicondyle of your arm, those tendons just get super, super tight, inflamed, and then very painful. So a lot of you will notice that you'll have that from time to time. don't wait. Get on top of it as soon as you can and get rid of it. As soon as I get a flare-up, I start working on my arms as well. And I've been doing that this week specifically, and my arm is feeling so much better already. Other common ailments that we see a lot with CrossFit is iliotibial band or IT band syndrome, where the IT band gets super tight and inflamed and sore. I've dealt with that one as well. So Graston is great at alleviating the symptoms of that and loosening up the IT band so you can continue to squat and lunge and do all of the active things that you do with your workouts. Graston is an absolutely wonderful technique. If you haven't tried it yet for your aches and pains, you definitely should. There's really no downside to this, and so many people just absolutely love and enjoy getting Graston technique done to them. And so we have regulars that are doing it all the time for their chronic issues, and they will not miss an appointment because it feels so good. So if you have any more questions, just contact us or just come up and talk to us.